Hi everyone, my name is Wei Yu. So I am the Community Advocacy Manager at California Pan Ethnic Health Network. So I'm located in the Sacramento office and I'll be your facilitator today. So thank you so much for joining our webinar today. It's the fifth out of the 8-part training of Mobilizing for Health Equity. So it's specifically on administrative advocacy. The training series is designed to support the work of a statewide coalition called Having Our Say. It's a coalition of over 30 organizations that works to ensure the voices of communities of color are heard as part of the healthcare policy discussion in California. So the training series was designed to help build Having Our Say's capacity in doing policy work and advocacy work. And it's also open to all community-based organizations who are interested in learning about advocacy, for instance, administrative advocacy today. So we're really happy to do this webinar today. And before I start introducing our speakers, we have a couple housekeeping items. So first of all, on your screen, you should be able to see the chat box, which we will be using as Q&A. So if you have a question for the speaker at any point, please type your question in the chat box and we will address your questions at the end of the presentation. Second of all, this webinar is being recorded. So at the end of the webinar, we will share a link of the recording. You can also find all of the webinar, the whole series on our Having Our Say Coalition website. So it's havingourSayCoalition.org. So feel free to check out the past webinars as well as the schedule of the future webinars. And finally, the most important thing is at the end of the webinar, we will have an evaluation survey because we appreciate your feedback and we want to hear from you at the end so that we can improve our work and also the rest of the webinar series. So without further ado, I'm going to go ahead and introduce our speakers today. Can we go to the next slide, please? So we have two amazing speakers today from CPEN in-house. So we have Carolina Valle. So she is the policy manager at CPEN and she does a lot of work both administrative advocacy work and other policy work in specifically mental health and oral health. And we also have Carrie Sanders, so she's our senior federal policy director, so she does a lot of work monitoring the federal policy updates as well as with the state. So I'm going to go over the agenda quickly. Can we go to the next slide, please? So we wanted to address a couple items today. So we just did an introduction, and then we're going to go over into, have you ever done administrative advocacy, and the what, when, and why for administrative advocacy, sort of as a 101 training, and the hows. So we'll give some examples of how do we do administrative advocacy and why it is important, as a tool when we advocate for health equity. And then finally, we have some exercise. So there's going to be an interactive session at the end using one of the, the current example of fighting back against proposed changes to the ACA Section 1557. So we hope that you will be able to interact with us during the session using some of the knowledge that we learned in the previous sessions. And then that's basically the agenda for today. So I'm going to hand over to Carolina to start us off. Can we go to the next slide?
Great, thank you, Wei Yu. Hi, everybody. My name is Carolina Valle, and I'm the policy manager here at CPEN. Really excited to join all of you today on this webinar to discuss administrative advocacy, the hows, the what, the whys, and to also discuss a opportunity to engage in administrative advocacy today, which we will do at the end, and that will be facilitated by Carrie Sanders. But first, just a little bit of introduction about administrative advocacy. These are just some examples of when we do administrative advocacy. So, when the details of implementing the law still need to be worked out, that's when we do administrative advocacy. When a law is not being implemented as intended, that's when we do administrative advocacy. And when you disagree with a policy that's been set by an agency, that's when you do administrative advocacy. Next slide. So what is administrative advocacy? Administrative advocacy is influencing policies and decisions that are made by administrative agencies. And that includes internal policies that are made by administrative agencies, budgets and grants that are set by administrative agencies, program operations that are set by administrative agencies, and regulations that are also set by administrative agencies. So the term administrative advocacy is really used to refer to any activity you do to influence a department or an agency's decision. It's not only about commenting on official regulations, but it's also about influencing how a government agency allocates its resources, such as what it prioritizes and who it gives out grants to, and its internal operations from the staff they hire to the data they collect. When an agency is considering new regulations, they are usually required to submit these proposals to the public for comment during the decision-making period. Federal regulations, for example, that are under consideration are published in what we call the Federal Register. Each state has its own method for proposing new regulations. The point is that you, as a member of the public or as a member of your organization, have the power to influence decisions. You have the power to change policy, rules, and regulations outside of the legislative system through administrative advocacies, such as commenting on existing policies, budgets, grants, program operations, and regulations. Commenting on regulations is one of the most common ways you can engage in administrative advocacy. But what are regulations exactly? Next slide. So just a little word about terminology. You'll hear us say regulations quite a bit today. And so I just want to speak to the differences between laws versus regulations. So as many of you know, and it has been discussed in the previous webinars on legislative advocacy, the California legislature can pass laws. These are bills that are passed by the legislature. They're also known as statutes. However, laws that are passed by the legislature are usually just general guidelines. They're not too specific. The specifics of the process, enforcement, those are called regulations. And the legislature is in charge of passing laws. But state agencies, like the Department of Healthcare Services or the Department of Public Health, they are in charge of nailing down the specifics of process and enforcement. Therefore, regulations are changed or introduced by agency oftentimes after the legislature passes laws. Next slide. So in other words, laws are just the first step. Administrative agencies are responsible for the details and implementation. Legislative language provides a general framework of the law, the intention, the spirit, the provisions, and who is responsible for what. But after a law is passed, it's up to the government agency or department to determine all of the details of how it's implemented. For example, although the healthcare reform law was almost 2,000 pages long, there are still a lot of details that were to be worked out, much of which was assigned to the Secretary of the Federal Department of Health and Human Services. Since the law has passed, there has been a proliferation of proposed regulations, including regulations about which services were to be included in the new preventative care guidelines, minimum standards for the state's health benefit exchange, and performance requirements for eligibility and enrollment efforts. Next slide. So these are just some examples of when we do administrative advocacy. We do it before pursuing legislation. So oftentimes we might not like the way a certain law is being implemented, and we want to address that with the administrative agency before we pursue legislation. While working on legislation is higher profile, your advocacy efforts may actually be better served by exploring administrative channels first, for a couple of different reasons. One, you may often be able to accomplish your goal simply by talking to the right administrative officials who have the authority and the will to do what you want done. Two, if working the administrative angle you haven't gotten very far and need to move on to a legislative strategy, you have at least established relationships with appropriate staff who will be impacted by the law you would like enacted. Administrative advocacy is also an important strategy during times of scarce resources, as any legislation that costs money to implement will be under intense scrutiny and will be hard to pass through the legislative process. So if you can find an administrative staff who shares similar goals, such as developing a reimbursement system for interpreter services, then you can get what you want done and with existing resources and avoid having to deal with the cost issue. And when there is a new administration in charge, such as we have experienced this past year with our new administration, you definitely want to reach out to the new administrative staff for a meet and greet, as the foundation to effective advocacy is establishing relationships. Next slide. So here's just a little quiz, and you can type into the chat box if you like to see. Maybe you've already done administrative advocacy and you didn't know it. Have you ever submitted comments on draft regulations? Have you ever met with local, state, or federal agency staff? Have you ever served on a state board or commission? Or have you ever testified at an administrative hearing? If you answered yes to any of these questions, you have already done administrative advocacy. Next slide. So let's talk a little bit about the hows, the details of how you can do it. Next slide. So before I go into this section, just want to mention that we will actually have an opportunity to discuss and practice some of these strategies at the end of the PowerPoint. First and foremost, know your federal agencies. So these are the logos for many of the agencies here at the federal level, but we also have them here at the state level as well. Next slide. Again, here are our state agencies here in California, and this slide in particular provides a very high-level overview of the current organizational structure of California's health programs. But they're always moving boxes around, so this is important to pay attention when there are changes to our agencies as well. Next slide. So you can just take a moment to look at this quiz and see if you know any of the department's responsibilities and what they do. Great, next slide. All right, so as I mentioned before, one of the most important strategies in administrative advocacy is developing relationships. When I first started working here at CPEN, I was really surprised at how easy it was to request a meeting with administrative officials. Many government departments convene stakeholder meetings and have advisory committees, but you don't have to wait until you're invited to participate to reach out and schedule a meet and greet. At our initial meetings with administrative staff, we often go over our work and policy agenda and try to have at least one specific ask, but also emphasize that we want them to see us as a partner and a resource. Once you have established a good working relationship with staff, you may be able to influence decisions more informally, and sometimes they may even reach out to you for help in exerting some external pressure on an issue they have been trying to advance. Now, one of the main challenges that you should know about with administrative advocacy is that it is difficult to balance maintaining positive relationships with government staff while also putting pressure on them at the same time. Next slide. So one formal and easy way to engage in administrative advocacy is to serve on the main advisory committees, task forces, and boards that are often looking for representation. It can be time-consuming, but it also increases your visibility and staff who start to see you as an expert and as a resource. CPEN, for example, has been actively recruited for consumer advocates advisory committees, and we serve on some of these advisory committees. So if you're interested, please let us know. And these are just some examples of formal committees that you can participate in. And do, again, reach out to us if you're interested in participating on any of them. Next slide. So this is a very important first step if you're interested in doing administrative advocacy. Get on agency listservs and read their emails. So these are some examples of administrative agencies and committees that you can get involved in. So the Managed Care Advisory Work Group, they look at health plans and the way they do their work. The Medi-Cal Dental Stakeholder Meeting looks at dental care, and the Mental Health Services Oversight and Accountability Commission, they look at, they provide oversight to our mental health system. And you'll see here on the right an example of an email that you might receive if you're on an agency listserv, where they will publicly request comments from you on a particular issue. And so the example that you're looking here on the right is the Mental Health Services Oversight and Accountability Commission last year requested input from stakeholders on the needs of immigrant and refugee populations. And so, you know, these emails, oftentimes we will overlook them, but that is oftentimes where we will get the most information about opportunities to comment on, in this case, funding for immigrant and refugee populations. State agencies often provide deadlines for opportunities to submit public comment as well. And so this is really important because you may want to partner and coordinate with another organization to develop the comment letter. And you'll see in this example on the right, at the bottom of the email, it says that they ask for survey responses to be submitted by a certain date. And so when you coordinate with another organization, you often will have to circulate the document of comments back and forth for shared input and editing. And CPEN, we often work with our coalitions, such as Having Our Say, to organize comments. And so with this particular example, we in fact did organize with other coalition members to submit comments on how we believe the needs of immigrant and refugee populations should be represented in this, what was a source of funding. And so the positive outcome from this particular comment letter that we submitted was that the MHS OAC actually incorporated some of our suggestions into the work that they do to support immigrant and refugees. Next slide. So as we've been sort of discussing today on the webinar, one of the most common forms of administrative advocacy is to comment on proposed regulations. Proposals for new regulations, as I previously mentioned, are often available to the public for comment, and this is one that we submitted some time ago on existing cultural and linguistic standards. Next slide. So, you know, to effectively conduct administrative advocacy and influence regulations, you need to be familiar with the regulatory process more broadly. As I mentioned earlier, once a law passes, the government agency or department usually has a set amount of time to develop regulations to implement the law. It is often a year or two after the law is signed. And this is an important time to connect with the agency to influence how they draft those regulations. you do not have to wait until it is officially released to begin your advocacy work. So once the agency has completed an initial draft, it will publish the proposed regulations to solicit public comments. And to make sure you know about the official releases of regulations, again, you want to sign up to receive those emails directly from the agency or department. The initial comment period oftentimes varies. It can range from 45 days to 90 days. The government then, after you submit the comments, will review them and revise their regulations, and we hope that they incorporate some of our suggestions. Depending on whether the changes are major or substantial, it will even sometimes go through another comment period. This cycle may even repeat several times, especially with controversial regulations. The end of the process is when the agency finalizes and adopts the regulations. Next slide. So we've talked a little bit about this today already, but here are some tips for developing comments. Some tips for developing comments. So look for opportunities to insert your policy goals. Look carefully for provisions that backtrack on prior wins. Justify your comments with data. It's always helpful to cite data or existing law to back up your recommended changes. It's also very important to be specific in your comments. Often we will provide them with the exact text we want to see changed in the regulations. And as I mentioned before, you don't have to work alone. You can work with other advocates. Coordinating with other advocates on your comments allows you also to divide up the work and create an echo effect where the administration is hearing similar messages from multiple stakeholders. And you can always also review prior comments from stakeholders. Oftentimes, with administrative advocacy, there's a long history of previous comments that may have been submitted before at your agency or with partners. And so it's really important to stay in touch with the folks that have been working on those particular issues that you want to see changed. Next slide. So, another strategy is to schedule a meeting with agency officials. You can wait for proposals for new regulations to become public for comment or to become available for public comment. But sometimes you or your organization may have a concern that is currently not open for public comment. You may, for example, have clients that are experiencing major barriers to care that the department or agency does not pay attention to. It's really important to schedule a meeting with agency officials, especially when we start to notice those patterns among clients that are directly impacted. Next slide. So this is an example of an issue that we raised to the Department of Healthcare Services. It's one where we organized our own comments to request a meeting with the department on an issue that we were seeing with clients, which was challenges with language access in dental. And so here on the left, you're looking at the example of a letter that we submitted where we requested a meeting with the department to discuss our concerns regarding language access. Again, this was not in response to a proposal that the department put out, but rather it came from our partners. Our partners actually elevated stories about clients that were having challenges getting interpretation services at their dentist's office. And so we convened our coalition partners to study this issue, and we discovered that there were a lot of barriers to language access and interpretation services. So we decided to develop our own original comments and request a meeting with DHCS. And this took a long time. It was several months of back and forth and editing because we had a lot of concerns and we wanted to make sure that we were specific, that we incorporated the advocates that were really concerned about this issue, that we cited previous laws and requirements. And so, and that we also had enough time to circulate for additional sign-on. And so we ended up getting over 25 organizations to sign on to this comment letter. And so really the point of this story is that you can respond to proposed changes from state agencies and departments, but you can also write your own letters and request meetings. This is a powerful strategy, particularly when you gather lots of supporting evidence, stories, and sign-ons. Next slide. So lastly, you can also participate in public hearings. You can testify on a proposed regulation. Hearings on proposed regulations, they don't occur often, which is why it's particularly important to be present and mobilize attendance when it does occur, as it is often a controversial issue. Because public hearings by administrative agencies are rare, it is also a good opportunity to get media attention on your issue. Next slide. So you can take a moment to look at this quiz. If you could click one more time, please. Okay, so one more time, please. Again? Again? Thank you. Okay, so you can take a moment here to look at which of the following examples are administrative advocacy. 1, commenting on draft regulations. 2, appearing on a news show to influence legislation. 3, serving on a state board or commission. 4, all of the above. Or 5, 1 and 3. So I know we don't have an actual pop-up where you can check, but hopefully all of you guessed 5, which was 1 and 3. Commenting on draft regulations and serving on a state board or commission are both examples of administrative advocacy. Next slide. So I'm going to hand it off to my colleague, Carrie Sanders, and she's actually going to talk with you all about the proposed changes to the ACA's Section 1557, Section 1557, it's a mouthful. This is actually a current opportunity to engage in administrative advocacy. We are seeing some attacks on this section of the law that we want to fight back against. So I'm going to go ahead and pass it over to Carrie now.
Great. Can you guys, hopefully you can hear me. Hi, this is Carrie Sanders, Senior Director of Federal Policy with CPEN. Nice to talk with you all. I know it's been a little while, but I'm excited to just talk about this opportunity to actually take action through administrative advocacy. So a little bit of background, and if you could advance to the next slide. So enacted in 2010, Section 1557, also known as the Healthcare Rights Law, is the non-discrimination provision of the Affordable Care Act. It prohibits discrimination in health programs and activities receiving federal financial assistance, health programs and activities administered by the administrative branch, as well as entities created under the ACA, including state marketplaces like Covered California, as well as health plans sold through the marketplaces. Section 1557's protections extend discrimination on the basis of race, color, national origin, including language access, sex, age, and disability by referring to existing civil rights law. It's also the first federal law to ban sex discrimination in healthcare, particularly for transgender individuals, although California actually already outlawed this type of discrimination prior to the ACA. Section 1557 also recognizes that individuals may be part of multiple protected classes and may face discrimination because they belong to one or more of these classes. And as such, requires health plans and health entities to notify individuals of their rights and where they can go to complain if those rights are violated. It also allows individuals a right of action should their rights be violated. Next slide. So in courts and through regulatory action, as Carolina mentioned, the Trump administration has been vigorously working to dismantle the Affordable Care Act. On May 24th, 2019, the administration released a proposed regulation, which was entered into the Federal Register, which is the formal rulemaking process in June, that would undermine or eliminate key protections of the ACA's non-discrimination provision, or Section 1557.
The proposed rule does a number of things. First of all, it exempts a broad array of healthcare programs and entities from compliance with 1557. So 1557 essentially expanded the universe of organizations and entities that had to comply with non-discrimination laws, and this tries to narrow that again. It also eradicates the non-discrimination protections for LGBTQ plus persons in multiple HHS regulations, eliminates requirements that health facilities and other covered entities post notices of legal rights, including how to file complaints and in-language taglines, discourages language access plans. Under federal law, Medi-Cal and other public insurance programs are required and health plans are required to have language access plans showing how they will meet the needs of their limited English proficient beneficiaries. And this makes it less of a requirement and more of a voluntary action. It also will impede access to reproductive health care and in particular abortion services, and will sanction discrimination by religiously affiliated hospitals, providers, and health plans, as well as limiting enforcement by restricting the ability of plaintiffs to file court actions. One thing to note, I do want to say that although this is, potential huge change at the federal level, as I mentioned before, California already had very strong non-discrimination protections in state law. And in fact, in 2017, CPEN and Having Our Say worked on a bill, SB 223, which essentially aligned the Affordable Care Act's federal non-discrimination regulations with state laws and regulations. And so as a result, we actually require health plans and entities in Covered California and DHCS to post non-discrimination notices, to provide information on how to access language assistance services, and health plans are already required to do language access plans. That said, this is a huge threat, and the reason obviously is both national at the national level, but also in terms of the type of confusion that a federal rule change like this could have on providers in California and in other states who may suddenly think that they no longer have to follow federal guidelines or federal rules. CPEN is teaming up with the Asian Pacific Islander American Health Forum on a digital, they're leading the campaign, digital campaign to generate 5,000 unique comments on the proposed rule. And we are participating with this and hope that you can join us. Next week is a week of action. It's a Language Access and Immigrants Week of Action from July 29th to August 2nd. And CPEN will also be sending out an action alert with sample tweets and other ways that you can take action during the next couple weeks. Comments are due August 13th, so we're trying to build awareness and interest in filing comments before that deadline. Next slide. I like to think of try to break down administrative advocacy into easier bite-sized pieces, because we understand that it's a little daunting if you've never done this before. Going to a federal website, trying to figure out how to draft your comments and what to say. So as part of our partnership with the Health Forum, we actually will be providing you all with a link to comment on the proposed regulations. And three things to kind of keep in mind. One is, through this link, you'll be able to go directly to a website, so we'll take you to that site. So the first step is follow the link in order to find where to comment. The other two things to really keep in mind, for comments, they don't have to be long. They don't have to be, with citations or references. Really, this is an opportunity for you to say why you think these changes are a bad idea. And the changes will impact everyone from LEP to transgender to women's reproductive rights. And so
folks should feel free to comment on all of those or one of those, or really to focus your comments on what you feel is, the most resonates with you. And then thirdly, really think about sharing a personal story or that of a community member. So in addition to kind of the overarching, why we feel this is bad or why you think this should not go through. If you have a personal story, great. If you work for an organization that works on reproductive justice rights, or you serve a lot of LEP community members, that's another way and another angle to really talk about what the potential impacts would be. So again, just going back to the previous slide, in terms of the calendar, comments are due August 13th. Next week will be a week of action. We'll have lots of additional information to share with you. And we also have, Weiyu has a follow-up email that she'll be sharing with you all that has some of these links that you can go to comment directly. So that's, next slide. So that concludes our presentation, and we're happy to take questions. Wow, we're way on time. This is great. Thank you both, Carolina and Carrie. So let's see if people have been posting questions. So if you're still digesting the information, feel free to, type your questions through the chat box. I actually have a question for both of you. So would you like to share just a little bit about, so we talked about a lot of the examples of like the administrative work that CPEN does here with other advocates. So what are some of the ways that community-based partners, community-based organizations and partner organizations can be more involved in this process? Feel free to start.
Yeah, that's a really great question. I think the first thing that comes to mind is that we at CPEN will often talk about upcoming administrative advocacy issues through the Having Our Say Coalition, which is what Weiyu described in the beginning. It's a coalition of over 30 organizations here in California, and we really discuss a lot of the items that are priorities through the Having Our Say Coalition. We also have, for folks that are interested in more behavioral health issues, there's also a statewide behavioral health equity collaborative, and they're a coalition that focuses more primarily on mental health and substance use issues. And so on that particular topic, we often will talk about administrative issues in behavioral health with the Behavioral Health Equity Collaborative. So I would encourage folks to get involved with both of our coalitions if they'd like to learn more about our administrative advocacy opportunities.
And I would just say, I think, as we hear about opportunities to participate, we will work directly with Weiyu and other staff to share those opportunities with folks. So I think just recently we were able to share some of your comments on the implementation plan for Health for All Young Adults with the department. And, currently they are taking under consideration, they're actually looking at whether they can provide some funding for community review of the Health for All Young Adult notices. But it's really, really important when these opportunities happen that we, can work with you all to really share what folks are thinking and what you want to see happen as the administration moves forward with new projects and plans. Thank you. Let's see. Another question that I had is, so I thought it was great that, Carolina, you talked about balancing, voting relationships with key, players at different health agencies and, state agencies. Balancing that voting relationship part with maybe like when we meet with them and make demands and send in letters. Would you like to share just like some tips on like how do you balance that? Do we send in like multiple letters a year, or do we try to space it out? Yeah, I feel like speaking from your personal experience, what are some of the pro tips that you could share with us?
Yeah, Carrie will have a lot to say about this too, because she's really been leading a lot of our administrative advocacy here at CPEN for many, many years. I will say that through my experience doing administrative advocacy, it's a lot of the same principles around, having relationships, right? Relationships you have in your own life, right? So consistency, making sure that you consistently show up to meetings and are keeping track of the updates that are coming from state agencies and departments. Also to, as we discussed during the webinar, we encounter so many issues with our healthcare delivery system, and so it can be really hard to keep our state agencies and departments accountable, which is why it's really important that we really try to be as specific as possible, because it will make it easier for us to follow up with them, and so that we can kind of break down some of our asks. So one thing I would say in terms of managing the relationships is really think specifically about what change you would like to see, because a lot of times, again, these issues are really, really overwhelming. The challenge with administrative advocacy is that we have to break down a lot of the needs into specific asks so that administrative agencies can really tackle them and have some wins as well, right? I don't know, Carrie, what else you want to add about that?
No, I think that's a perfect answer. I think that administrative advocacy is about relationships, and establishing, strong relationships requires, a level of trust and interaction. And, oftentimes I find that once you actually start to talk with folks, there is an interest. I think people are interested in, doing the right thing and trying to, make programs and policies, more accessible. There is interest in, advancing more equitable solutions, but I think the biggest obstacle sometimes is the how. How do you do it? And so, sometimes the will, but there's kind of, I think there's a lot of opportunity. It's just really about, sitting down and thinking and trying to problem solve with each other and with folks at the table.
Thank you. That's really helpful. So folks are pretty quiet today. No one's asking questions. I hope you're processing that information well and that was, useful and beneficial for your work. I guess the final question that I have for Carolina and Carrie is that would you like to share maybe 1 to 2 projects that you're doing right now that you're using heavily, administrative advocacy as a tool?
So a great example of this is that last year we, along with our partners, did some research on improving access to mental health care for immigrants, particularly undocumented immigrants. And so over this past year, since we finished that research, we've really been raising the concerns that we heard from our research to administrative officials. And, we have a new administration. As Carrie discussed, there's a lot of sort of interest in issues around equity and mental health. And so just a small example is that we've had several meetings with new administrative officials that came in with this new governor and have been talking about and educating them about the challenges that immigrants and undocumented immigrants are facing when trying to access mental health services.
And then I would just add, and I hope that let me just say, I hope that beyond this training that we'll have other opportunities to provide updates to you all and gather input more regularly, because there are a lot of things that are happening all at once. The 2 things that I would just flag, we talked about Help for All Young Adults, and that is moving forward, and there may be some opportunities for engagement there. I think the other big thing you all worked on this year was the funds for navigators to do outreach and enrollment through the department. Now that we were successful, which is not
always the case, and in fact, for some of us, it's a little bit of a new a new position to be in. Now we need to figure out, how we can work with the administration to get the funds out the door and really administer them. And so, we may be in touch with you about that opportunity. And then lastly, I would just flag for folks who, are working or tracking Covered California. They are beginning to open up and think about their contracts for their qualified health plans, and whether they want to renew, or how they want to renew some of their disparities, requirements. And so there will be some opportunities both there and through the administration's 1115 waiver process in Medi-Cal, to really think about how care is delivered and how it could be done more equitably. So we hope to provide you all with some background as we move into these conversations on the Covered California contract and the 1115 waiver, so that you can, hopefully engage and feel, like you can participate in those conversations.
Great, that's awesome. Well, thank you again, Carrie and Carolina. That was a great presentation. So we're going to wrap it up now. Hopefully I'll give you back 10 minutes of your day. So at the end of this webinar, once we close the webinar, there should be a survey for evaluation. So feel free to fill in the survey. So we will be sending out the recording and the slides and relevant information soon. And I hope you have a great rest of your Thursday and week, and we'll talk to you next month. Thank you.